I'm Mrs. Princey, Associate Professor in Mental Health Nursing. Right. Psychotherapy can be given in any form. It can be given to as a one-to-one session. Okay, that is an individual psychotherapy or counseling that we give. Also, the psychotherapy can be given in the group setting. Psychotherapy in the group setting gives a social arena in which the people or the members can learn about their assets as well as their deficiencies or deficits through interaction with peers and the authority. So, the topic for the discussion today is on the group therapy. Before going to the group therapy, let us see the brief history of group therapy. How all this group therapy came into existence or how it is being practiced. Group psychotherapy began at the turn of century when Joseph Pratt, a Boston physician, recognized the positive effects of bringing the patients with tuberculosis together. So you know how dangerous the tuberculosis is. So people with the tuberculosis, they are isolated in isolation hospitals or sanatoriums. So that is what they are meant to be isolated, because tuberculosis is a very much infectious. If you take the history, some of these patients did not have an access to a hospital or to a sanatorium. So those patients were brought together in a group. That is what Joseph Pratt had done. The recovery for tuberculosis requires a strict hygienic practices. So this physician taught the patients in the group as to how to follow the hygienic measures, which helped to combat the disease. Other psychiatrists were very much influenced by this method which Joseph Pratt had started to follow. Cody Marsh even included dance practice classes for this type of the group in the hospital. He said that by the crowd they have been broken, by the crowd they shall be healed. So what he meant was, the patients were isolated from the society or from the community or the groups. So he wanted to cure or heal the disorder of tuberculosis by the group therapy, by bringing the crowd together, by inculcating this counseling sessions, activity sessions, dance sessions, because even the tuberculosis patients, they were mentally becoming very weak because of the feeling what they had experienced of isolation from the community. The role of charismatic leader and dynamics of group relations were recognized by Sigmund Freud in the later. Let us see the definition of group. A group is a collection of individuals whose association is founded by commonalities of interests, norms, and values. Members in the group or group therapy can be by choice or by chance or by any kind of these circumstances. So this is called as a group. Let us now learn what is group therapy. It is a type of a psychiatric care wherein several patients meet one or more therapists at the same time. The patients form a support group for each other as well as receive expert care and advice from the therapist. So you can say that a psychotherapy or a group psychotherapy is a group, okay, who get together to get the help or seek the help from a trained therapist. The next definition of group therapy is analyze each other with the assistance of one or more psychotherapists as in an encounter group. The next definition, it is a form of psychotherapy that involves sessions which are guided by the therapist and attended by several clients who confront their personal problems together. So it is a treatment process wherein we have got patients or clients okay, who are having the similar problems or the common problems, they get together, and with the help of the therapist, they're going to solve their problem. So that is called as the group therapy. Okay, the next definition of group therapy, it is a form of psychosocial treatment where a small group of patients meet together regularly to talk, interact, and discuss the problems with each other, as well as the group leader, who is the psychotherapist. So we can say that a group therapy is a form of psychosocial therapy wherein the social group, okay, is going to get together and they're going to solve all the psychological problem with the help of the therapist. Moving on to the selection of patients. So who are the patients who can be included for a group therapy session? Number one is a homogeneous group. So what is a homogeneous group? A group which is having a common problem is called as a homogeneous group. Say for example, it is an alcohol anonymous group. So here in this group, we have got all the patients who have a common problem of alcoholism. So they will get together and they form a group and they will be getting the therapist, okay, who will be giving them the counseling on how to quit or withdraw from the habit of alcoholism. So that is called as a homogeneous group. The next indication is in case of adolescents or any kind of adult who are suffering with the personality disorders, they can form a group and the therapy can be given. Families and couples where the system needs change. Okay, so we have got some situations wherein the whole family can be undergoing a trauma. There may be a relationship problem or conflict. Okay, so they will undergo a therapy in the form of conjoined manner. So all the family members get together and they approach the therapist for a session. So even those kind of families or the couples who are having some relationship problems can undergo a group therapy in terms of family therapy, right? So this is about the selection of the patients for group therapy. Moving on to the contraindications. So there are conditions wherein group therapy is going to become a big failure, right? So number one is people with the antisocial personality or patients with the antisocial behavior. So if you include such kind of patients who are very aggressive or antisocial, the group may not work together. So the dynamics may not happen well. They may have an interpersonal conflicts and the aggressive behavior or the violent behavior that they may show with each other can be a problematic situation, not only for the clients but the whole group as well. So such a person who is having the antisocial kind of a personality may not be included or indicated for a group therapy. The next contraindication is the person who is actively suicidal or severely depressed patients. So such kind of patients, when they are undergoing a group therapy, they may not feel the freedom to express their feelings. Okay, since they are into depression, they may not be an active member in the group. They feel very uncomfortable, they feel very withdrawn, they feel very inferior, or most of these clients who are having suicidal thoughts may not be indicated for a group therapy sessions because group itself can be an uncomfortable feeling for such kind of the patients, right? The next contraindications is the patients who are delusional or the people who may incorporate the delusion into the group itself, right? So there are conditions wherein we have got the shared delusion, wherein one person shares his delusion. So if such a client who is having the delusional problem is being included in the group, then group can also get influenced or affected by the delusion. So such kind of a shared delusions can happen for the group. So such clients are contraindicated for the group therapy sessions. Moving on to the composition of the group. So if you take the composition of groups, so it is based on the size, the homogeneous versus heterogeneous group. We have the open versus closed group. The last is the frequency and the length of the session. So this is the composition of the group therapy. So let us see the size of the group. So usually if you take a group therapy session, the optimal size of the group is about 8 to 10 members, right? So we have a group which is composed of 8 to 10 members. So that is the size of the group. Moving on to the homogeneous versus the heterogeneous group. So what is a homogeneous group? So homogeneous group is the one who is having the common problem. These members who are included in the group have got a similar diagnostic problem or the background. For example, all may be suffering with depression or all may be alcoholics. So that group is called as the homogeneous group. Moving to the heterogeneous group includes all the members who may have the different conditions, right? So each person may have a different emotional problem. So, but they get together to form a group, which is called as the heterogeneous group. The next composition is about the open versus closed group. So what is an open group? Open group is a group in which a new member can join at any time. Okay, so we have got a group which is formed previously. So at any time a new member can join the group. Such a group is called as open. It is open to all the members. At any time they can come and join the group. So that is called as open group. Closed group are those in which all the members begin the group sessions at a particular time. They may all take part together in a 12-week session. Okay, so that is called as a closed group. No new member is allowed to enter into the group. The group is already, fixed. So such a group, they come together. Maybe a 12 weekly session. They may come to get together and they will solve their issues or concerns. Okay, so that is called as a closed group. Moving on to the frequency and the length of these sessions. Most of the psychotherapists conduct the group sessions once in a week for a duration of about 45 minutes to an hour. So that is the duration of each session, right? So this is about the composition of the group therapy. Moving on to the working pattern of group therapy. So how is the work happening in the group therapy? The members of the group share with each other their issues or concerns or the problems that they are facing. A participant from the group can talk about the experience that he or she had for a period of a week. It can be related to any kind of the event which made them feel uncomfortable or which made them feel low. So such kind of an event they can share with the group and what they did during that particular situation, how they were able to face a situation and overcome the particular problem. So that is going to give an insight to the other people who are there in the group as to if they even experience such a kind of a similar situation, how they can tackle the situation. So that is what is done in the group therapy. Moving on to the approaches of group therapy. If you take the therapist's role, the role of a therapist here in the group therapy is to be a facilitator. He should see to it that he provides a safe and comfortable atmosphere for the group so that they can have the self-disclosure. The next approach is the focus is on the here and now. So what is this based on the day-to-day issues or the concerns? Okay, whatever the issues are that they face on a daily basis, the focus is on those kinds of the issues. The group therapy uses the transference situations to develop insight into their particular problem. So any kind of a situations which the client is facing, the changes in the situations, what are the problems that the transition has made. So that can be used in the group situations to tackle the problem. When you conduct a group therapy, you have to keep in mind to protect the members from the abuse or becoming a scapegoat. So at times you have got people who are, very dominating in a group. Some people are very reserved who don't even talk. Some people, take all the blames or they may just make the group members to become a scapegoat, right? So they may undergo the abuse in the group. So as a therapist, you have to see to it that each and every member is protected from the abuse or from becoming a scapegoat. The next approach is whenever it is possible, see to it as a therapist that you give a positive reinforcement for the clients. This is going to give a ego support and a future growth for the patients. The next approach is when there are patients in the group who have this circumstantial symptoms, okay, patients with circumstantiality or patients with hallucinations or delusions. Such kind of a patient should be protected and their self-esteem has to be considered. And also you have to see to it that you set limits on their behavior so that they are not going to harm the other patients in the group. So very important as a therapist, you're going to see to it that patients who have these symptoms of hallucination and delusions, that their self-esteem is protected and also the other individuals are protected from these kinds of behavior. The next approach is the therapist should have the ability to recognize the clients who are fragile at some times. Okay, sometimes they may feel very fragile, very weak, very inferior. Such clients has to be recognized by the therapist, and the approach what we use for such clients should be gentle, supportive, and a non-threatening manner. We have to approach the concerns of such kind of the clients. When you conduct a group therapy session, you see to it that you use the silence as much as possible, because silence is going to give an opportunity for the client to do the introspection, and also it is going to facilitate the insight or the awareness of the client. So at times when the group therapy sessions are going on, it is advisable to have some kind of a laughter or some kind of a content which is very much funny or a joke, okay, in the sessions, because this kind of emotions or behavior is going to bring a group cohesiveness. So at times it is necessary that we share some events or situations which are funny, which makes the group a more cohesive one. When you conduct a group therapy, see to it that you also include the role playing technique or the psychodrama, because when the group is witnessing a psychodrama or role playing, it is going to bring about an insight or awareness in the client as to how he can even tackle such kind of a situation when he is experiencing it. So this is about the approaches of the group therapy. Moving on to certain therapeutic factors which are involved in the group therapy. Number one is the sharing experience, support to and from the group members, socialization, limitation, as well as interpersonal learning. So these are the therapeutic factors that has to be considered. So let us see the first one, which is the sharing of experience. So sharing of experience is going to bring an insight and awareness to the client that they are not isolated. They feel that it is not only me who is undergoing this problem or this situation. We have got other members or other people also who are undergoing a similar situation. So he doesn't have to feel that feeling of isolation. That's what sharing of experience is going to help the client with. Hearing from the other clients, okay, in a group therapy is going to seem to be more convincing, and the reassurance what they get from a therapist is going to be not so effective, rather than when the group members share their problems and their concerns, and when they share their experience, the group members get a positive feeling and they feel more assured than what the therapist does. Next is support to and from the group members. So at times when the group is sharing their feelings or experiences, okay, the group is going to support each other and they're going to get the support from the other members in the group as to how to handle the situation. The suggestions that they get, they pull in so many suggestions and ideas that each and every member contributes so that they can seek the help. It is also going to instill the sense of being together rather than being isolated. They feel the group together and they feel and handle the situation together. So that is the importance of support to and from the group members. The next factor is the socialization. It is the acquisition of the social skills within a group through the comments that members provide about one another related to the deficiencies in the social skill. So when they are working together in the group, the group can identify certain social skills which cannot be accepted or which is not right. So during that time, the group is going to identify those social skills, and they are going to work together so that the individual gets benefited. Say for example, the individual in the group therapy session is not maintaining the eye to eye contact, so which is very much necessary for a communication and for a social skill, right? It can be identified, so such a behavior can be identified by the members in the group, and it can be discussed openly, right? Trying out new ways of interacting with the group members. The next one is the imitation. So what is this imitation? It is the learning from observation and adapting the behavior of the other group members. So when a group is there, they get influenced with each other. Even they try to learn certain behaviors which are very much accepted, are very much assuring the group members can try to imitate the other members in the group. So such behavior is going to help them in the facing social scenarios, right? So that is about the imitation which can happen in the group therapy. The last one is interpersonal learning. So as the name says, interpersonal learning, we are having an interpersonal relationship which is happening in the group, right? So each and every member try to learn new technique or a new skill when they communicate with each other. So it can be a helpful thing for a person, right? So they learn new ideas or new skills or new behavior when they form a group, right? So that is called as the interpersonal learning. So these are certain therapeutic factors which are considered in the group therapy. One is the sharing experience, second is the support to and from the group. We have got socialization, imitation, as well as interpersonal learning. Moving on to the types of the therapeutic group. So we have got different types of groups who get together to undergo a therapy called as group therapy. So the first group is called as self-help group. Then we have interpersonal group, encounter group, as well as the psychodrama. So what is a self-help group? It is also termed as mutual help group, in which the group consists of members who are having the same concerns, who are sharing the same or the common issues, conditions, or situations. So thus they are in a position to share their experience and support each other in solving the issue. We have got variety of the self-help group, okay, with different kinds of the issue which they share in common, right? So for example, we have got the self-help group related to the alcoholism, emotional concerns, physical disabilities, eating and food issues, addiction, bereavement, and illness. Okay, so all these different issues. So individuals who suffer with the concerned issue, they form the group and they share their concerns and they help out each other. Okay, so that is called as the self-help group. The second group is the interpersonal group. So here we have got an interpersonal approach which is going to deal with psychological, behavioral, as well as the emotional problems, which is going to emphasize the interaction in the group, including the analysis of the group events, experiences, as well as the relationships. So that is called as the interpersonal group. The third group is the encounter group. So previously we had this encounter group in the group therapy sessions, wherein psychotherapy was provided to the clients, okay, as a short-term treatment for the non-psychiatric conditions. So such kind of people were included in the encounter group. These groups were also known as the sensitivity awareness groups and the training groups. Okay, so this is the encounter group, where earlier they used to have these clients who had the non-psychiatric condition as a short-term treatment process. They used to get together and solve the issues. Okay, so that is the encounter group. The last group we have is the psychodrama. It is an action method which is often used in psychotherapy, in which the client uses the spontaneous dramatization, role playing, and dramatic self presentation to investigate and gain insight into their issues in the life. Okay, so whatever the concerns or the problems that they have in their life, through the psychodrama or through a dramatic approach, they're going to let it out, and also the other members in the group, they are going to witness that, so that when they observe, they also get an idea as to how to tackle the problem when such situation arises for them. Right? So this is about the various types of the group therapy. Moving on to the techniques which are useful in the group therapy, we have got some techniques. Number one, reflecting or rewarding the comments of the group members. Okay, so there are certain comments or suggestions that the group members share. So as a therapist, it's very much important that you're using the technique of reflection. The next technique is asking the group reaction for the members' experience or the members' statement. So there may be one person who just gets up and shares his concern. So you have to see to it what is the response of the group member. Then you also ask for the individual response or reaction to one member's. It can be as a group they give a reaction to an individual statement, or it can be like asking individually each member what is their reaction related to the person's statement. Another technique is you're going to point out the shared feeling which happens in the group. Sometimes the group may experience or share the common feeling, right? So which is called as shared feeling. So that you're going to recognize and you're going to point that out in the group. And at the end of each session, you see to it that you're going to summarize the points. So whatever the points which were discussed in the group therapy sessions, what are the concerns, how was the problem solved, or how the certain situations were tackled. So all those things are you going to summarize at the end of the session, right? So this is about certain techniques that the therapists are going to use when they conduct a group therapy sessions. Moving on to the advantages of group therapy. Group therapy is suitable for large varieties of issues or concerns. It can be related to the behavioral problems or emotional problems, psychological problems, or people who have got difficulty in the interpersonal relationship, people who are undergoing the disorders like anxiety disorders, people with depression. So it is going to be a number one advantage when they involve in the group therapy session. Moving on to the role of nurse. So, what is the responsibility of the nurse in the group therapy? Number one, you're going to impart the information. So, what is this? Is you're going to provide the information to the group in terms of it can be the plan of a group therapy session, what is the topic that is going to discuss. So, as a nurse, you're going to coordinate with the members of the group. You're going to collect what is their concern. You're going to intimate to the group members as to when the therapy sessions are going to be conducted, how frequently it's going to conduct, when they're going to meet up the next time. Okay, what is the concern that is going to be addressed? So all the information you're going to give. So you're going to act as giving an information to the group members. The next responsibility is instilling of hope. As a nurse, you're going to increase that feeling of hopefulness for the group members. The next responsibility is to be universality. So what is universality? The group members may have got the similar feelings, similar experience or situation that they have faced. So you're going to see to it that the universality or the in common, what is the issue of concern that you're going to address. The next responsibility is altruism. So altruism is like you're going to have that feeling of you wanted to be very good to the people in the particular group. So you want to have the responsibility of helping the others in the group. Next is you're going to help in the development of the social interaction skills. So it can be related to you're going to teach the group how to develop the socialization process. Okay, how to interact with the group, how to develop the social skills in the group. So that is what you're going to teach the clients, to develop the socialization skills. As a nurse, you're going to initiate the behavior. So how you're going to initiate the behavior? As you know, in a group there is a chance that the group members start to imitate each other, right? So whenever there is a behavior which is, can be accepted, such a behavior should be imitated by the other members in the group, so that they can adapt to the changes which happens in their life, right? So as a nurse, you're going to initiate that, or you're going to give the opportunity to the group members to learn or to imitate the new behavior which is widely accepted. The next responsibility is to bring about the interpersonal. So, what is this interpersonal learning? You have to be in a position, you should see to it that the members learn from each other. Okay, they have to get the support from each other. They have to develop that kind of an interpersonal relationship, that the learning should happen from each other. So you are going to motivate that interpersonal learning when you're working for a group. The next one is the catharsis. So catharsis is one of the treatment process wherein the feelings which the person had experienced previously will be pent up. Okay, so such kind of feelings will be ventilated out through the catharsis. So when the group therapy session is going on, you see to it that you follow this catharsis, wherein you have to encourage the client to ventilate all those feelings which he had experienced in his life, so that he feels comfortable once he shares his experience or he ventilates his feelings or emotions. The next responsibility is to bring about the group cohesion. What is group cohesion? The group members should get attracted with each other, so that they feel the feeling of we feeling as a group, that they're going to face the issue of concern as a group and not being isolated, being alone. Okay, so you're going to bring about the group cohesion. These are some of the nurses' responsibilities. So a group therapy session is a therapy which is going to help out the people who have got the similar concerns, the problems, to get together, share each other's concerns, and bring out a proper solution with the help of a therapist. So that is what is the topic about. Hope you all have understood the topic.